This session is for health centers who are interested in joining the Kansas Care Network, which we'll get into what all of that is. So what we'll be talking about today is really what Kansas Care Network is, why it was created in the first place. You might have some ideas based off of the last session that we just went through. We'll talk about what participation, if your health center is not currently in KCN, what participation can mean for your health center. And then we will we'll talk a little bit about in depth kind of what those core components are that KCN will be doing for health centers as part of participation. And then I think it's important to understand governance. One of the big things around Kansas Care Network is that it is health center led. So we'll talk a little bit about that and how health centers have a role. And then if your health center is interested in joining, we'll talk a little bit about what that process is like and what you need to do next. So let's kind of jump in. And again, Q&A anytime. We don't have to save it toward the end. And this one you might have some questions. If I were a health center hearing this, I would have questions. So just before we jump in, raise up hands of how many health centers are currently in Kansas Care Network, you think? Okay. And who's not? Welcome. Okay. So one of the reasons we're having this session is that Kansas Care Network, which we're transitioning to become a clinically integrated network, has been working for the past couple of years to have a cohesive health center focused network that can contract for value-based payment programs with Medicaid MCOs. Our goal, and we're actively contracting currently, is to have 3 value-based payment programs with the MCOs in 2026. And so we are in active negotiations. I can't go into too much depth about that, but we'll talk about themes so you can understand what the network might be getting into. But we're at a time right now where those negotiations are occurring, and there is an opportunity to join the network to participate in these new opportunities that your health center, due to size and attribution, may not be able to leverage on your own. So what is Kansas Care Network? So formally, it was incorporated in 2023 as an accountable care organization. So you might hear about this in the term of ACO. It was really confusing. There are about 40 of these types of networks across the country that have been, that are led by health centers, that are sponsored by primary care associations, and they all are clinically integrated networks. And so the board has decided to transition that process. And so that is what Kansas Care Network will be. And what does that mean? It essentially means you as a participant, so we have 7 health centers that are currently participants. We have no active contracts yet. 2026 is when we will officially launch those. But essentially, as a participant in this network, your health center, Kansas Care Network, essentially negotiates new or different value-based payment arrangements that as a group of health centers, you will participate in collectively, with the goal of having more financial opportunity working collectively as a group. So that's kind of like the future output of this. What KCN is practically doing is to try to make value-based care, knowing that it's not going away and it's going to be actually increasing and ramping up over the years, to make it more health center friendly, health center led, and having more infrastructure for you all to leverage that you probably have at your disposal now, to be more efficient and strategic with your value-based care activities. So I know many of you were in the previous session. This work is complicated. It's complicated to keep organized, and it's a lot for your individual teams to do. The goal with KCN is to take that burden off of you, where KCN tells you the measures that align across contracts, gives you the resources and tools in Azara drives to leverage payer data so you're not logging into 3 different portals, and making that data actionable so your care teams can actually do something with it instead of seeing a report 3 months afterwards and probably not being able to interact with that patient again to really move the needle on a particular metric. So it is our goal and intention to make this just a lot more seamless and make it health center oriented. Because if any of you have talked with payers, they don't understand health centers. They don't understand your mission. They don't understand how you see patients who are uninsured, and that is really important to you. And value-based care is for insured patients. Kansas Care Network gets that. And so we are working towards a cohesive network that, again, is health center led, and puts you all kind of in the seat of driving a lot of the governance decisions, and opportunities, new opportunities that can come from Medicaid, and potentially other payers in the future. So what you'll see on kind of this waterfall thing, these are I think the core areas that KCN is really aiming to implement as new participants join and as we have the agreements in 2026. And we're going to spend a bit more time on these in future slides, so I'm not going to go into it a bit deep here. But really, everything that we're coalescing around is targeted in these slides here. So why does it exist? Again, I think this might be the 3rd time I've said this. No matter what administration is in Washington, value-based care and value-based payment is not slowing down. Everyone has their own perspectives on what that looks like. The Trump administration wants to make financial risk happen more quickly in Medicare programs. The Biden administration felt like practices and health centers needed more time to take on downside risk. And so it's all still there. It's not slowing down. There are just different views about how it will be accelerating and what goes into those models. I've seen this in my work in other states, and that health centers are unique. You deliver pediatric care, primary care, OB at some, but you're different than primary care practices. And there are things about health centers that need to be united and also, I think, brought up in a way that MCOs understand. It is really challenging to have a contract negotiation discussion with an MCO if you don't have a lot of attributed patients. They are like, here you go, this is what you get, no negotiation, take it or leave it. With Kansas Care Network, we can, as a group, come together and say, these are things that are important to health centers participating in value-based care. As a group, leveraging, broader participation and having more attributed lives, if you will. That's what the MCOs pay attention to. That brings voice and that brings influence. And that is one of the other things that I think is one of the reasons why Kansas Care Network was founded in the first place in 2023. And then last, I know some of you are probably participating in the MSSP with Aledade. There's Main Street. There's all of these, what we call primary care aggregators or enablers that are doing this work out there. And they take a huge cut of what should be going to the health center. And one thing to know about this, in your peer networks that are implemented across the country, since health centers govern the network, they decide what health centers take home and what is kept to run and keep the lights on for the network. And so, yes, the Aledades and Main Street and And others, they have a huge sales and marketing team and can be very slick and they perform well. But you don't get to take home all of the dollars that you've earned by actually delivering the care to the patient. So this is designed for you all in mind, and you're driving what that looks like from a payment standpoint. Okay, so these are the areas that were in that little waterfall graphic earlier. And I want to shift to a little bit about what participation would mean for your health center. So as we've discussed so far, there are 7 health centers in Kansas Care Network. Kansas Care Network is only negotiating value-based payment agreements with the MCOs. So if you're interested in joining, your base agreement or your direct contract with the 3 MCOs that you get your PPS rate for is in place. We don't touch it. We have nothing to do with that. What we are negotiating is essentially a new opportunity that most health centers independently can't access on their own due to size. And so our goal is to bring more financial opportunity through these value-based agreements. So let's talk a little bit about what those value-based agreements might look like. So just to orient you, I'm sure some people have seen this framework. This is it's a federal public-private, a public-private partnership at the federal level that has convened. It's called the Healthcare Learning and Action Network. And essentially, they've laid out a framework for how value-based payment is categorized. So this is a very helpful reference when we're thinking about where we're starting and then where the potential can be in terms of financial opportunity, but also level of complexity and sophistication. The previous session that I just did was all around this category 2. And so fee for service, this one right here is just think about PPS. You see a patient, you get paid for that visit. There's nothing on top, no quality measures. We're past that now, especially in Medicaid, since we have those pay for performance agreements. So what we discussed, we're really in category 2C. Again, we looked at some of those PMPM amounts, like not that exciting unless you have a lot of patients, but then you also have a lot of staff that you have to cover expense for. And so Kansas Care Network, our goal is to move up the ladder here responsibly and appropriately to have different financial opportunities in these models available to your health centers. So the higher up you go, the more financial opportunity, but there's also more financial risk. And so it is the goal of Kansas Care Network to move up this ladder slowly and responsibly based off of how the network is performing. And so I won't go and I can't go into too many details around like what we're talking about the MCOs due to antitrust. But I will say that we are looking at some unique pay-for-performance opportunities, so different than what we discussed earlier. And then we're also looking at some shared savings opportunities. So again, things that your health center probably can't access independently. So these would be net new to your health center. So as we think about some of the core services, one of them, and I think this is really at the heart of at least getting started within the network, is that for the value-based payment arrangements, KCN is actively negotiating those on behalf of the participants. Again, not touching your direct contracts. We're not touching the pay for performance we just talked about. This is new stuff you probably haven't seen before. And so we are entering those arrangements. We have kind of a term sheet of things that we desire as a part of the contracting process. And they are really specific to health centers. And so when we are working with them, we are keeping in mind where the current network is, what tools we have available to us, and where we ultimately need to go based off of what the MCOs are asking and what their future plans are, as well as where the U.S. healthcare system is headed in terms of value-based payment. So this is one of the core areas that, whether you're a participant now or if you plan to join in the future, that this is kind of at the heart of getting those agreements in place. Next is one of the key functionalities that is exciting, I think, and we have access to this data, at least at a very early stage here. But as we had mentioned, the portals. Each MCO wants you to use their portal that produces reports that looks different than the other MCOs. And then all of a sudden you need to be proficient in 3 different portals, understanding how their reports work, understanding what is medical loss ratio, what is health benefit ratio, like are they the same thing, are they different? So one of the core things, and again, I've seen this work in many other states that I work with, especially where the PCA has an HCCN, is leveraging Azara drives. So if you all are in the HCCN, you know drives, you're very familiar with it. This functionality that we are expanding, we have access to one payer now, incorporates all the stuff that they have in the portal at your fingertips in drives. And again, it is based off of how Kansas Care Network, the agreements that will be in there, and how we want you to engage with that information and make it as actionable as possible. And so you're not spending time trying to figure out, okay, who's attributed to us? Where do I need to look? It will all be at your fingertips for the agreements that we will have in place. So I think this, if we're thinking about simplicity and the ability to actually do something with the data, this is something that is going to be a huge benefit. And we've been working on this for a while. So this will show things like your full attributed patient population. It's going to tell you who has care gaps. It's going to tell you on that attributed patient list how many of those care gaps are open, but you have them closed in your EHR. And it's going to, at least for one of the plans that we're with, it sends data back to them to close those care gaps. And so it really automates a lot of the manual and kind of like strategic work that you have to figure out. And it makes it so easy. I'm really excited about this. And I don't get paid by Azara. Like I don't work for Azara. And there's our Azara friends. So I'm just excited about this because it really takes the lift off of your teams to figure out what to do. Like it's all right there for you. So it's going to show you attributed lists. It's going to show you what care gaps are open. It'll show you the care gaps that the payer has information for. So let's say breast cancer screening is a measure. The payer has a claim for that. You don't have that in your EHR. That gives you some information that you can go find that for your that patient's medical record. So there's a lot of different uses around this. And then last, I think it also it integrates into the pre-visit planning tool, which makes this actionable at point of care. So a lot of things to be excited about here. And this is one of, I think, the practical tools that I think if I were really kind of weighing my health center's value-based payment strategy, and we were actively using drives, like this would be a no-brainer for me. Next is more of the kind of what is value-based payment? What do we need to focus on? Like, how do we learn from others? Kansas Care Network will support you in this journey. So it is our goal to not do essentially the session beforehand where we have to explain all 3 agreements and you have to wrap your head around all 3 of them. Our goal through supporting actions towards you all is to simplify that and say, okay, yeah, we have 3 different agreements, but these are the 5 measures. This is the target that we need to work towards. These are the key, best practices you should think about from a workflow standpoint. And let's hear from your peers. okay, how have you conquered this in, this part of Kansas? And what health center has, incorporated this into their pre-visit planning workflow? So we will kind of make it as simplified as possible. The staff, the team will provide that to you. And then we also want to cultivate an environment where you can learn from each other, because in a network or clinically integrated network like KCN, we perform together as a group. So the plans would see us as a cohesive network. And so they look at us in total and aggregate. And so we really have to think about performance in a different way. And so this model will enable that. Next is the financial opportunity. So this is something that will be ramping up over the years. And I think what's important to know, and we saw that the land framework that shows the different levels and the different level of complexity, as Kansas Care Network increases capacity and ability to perform, so will the financial opportunities. So when networks begin, it is slow. Financial opportunity does come, but it does take time to really reap the rewards and benefits of coming together as a network. And so I will say, in year one, it might not look like great. We have our 30-cent PMPM over here. It will be better than that. We'll have additional opportunity on top of that. But it takes time, and it takes time as networks mature. But that, I think, what is the upside of participating is that opportunity exists, whereas on your own, it doesn't. And so it is work that you're likely, already doing to some extent. This just gives you the opportunity to leverage the additional funds. And then collective voice. This is, I think, one of the core things that I really find valuable as a consultant working in this area. But you have community care, which is your voice in a lot of different aspects. With the federal regulations, there are certain protections around what you can talk about with payers as a collective group and what you can't. The Kansas Care Network enables those conversations to happen and to have health centers be a united front with the payers and have more influence and leverage. Again, that takes time, but I've seen it happen over and over again, and it's really rewarding from my standpoint, but it's really cool when you see hospital associations getting leverage, and then all of a sudden you have a network of 30 health centers having similar leverage. And so it's something that you kind of have to, there's no immediate financial impact to that, but it is an opportunity to influence, especially those who are paying you, to show how health centers need to be participating in what you require to participate. So I think I've hit on this a little bit. Our overall goals, we want to leverage the collective strength of health centers as a state unified front with the MCOs. The goal is to prepare and succeed in value-based care, because it's going to be a journey. This isn't something that everyone just has the time, capacity, or knowledge on how to be successful in these agreements. Our goal is to really empower care teams and provide you with the tools and resources to be successful here. And then the last thing, I think this kind of flows into two a little bit, but it's really looking at a broader population health perspective. Yes, we're talking about patients that are attributed, they have insurance, but anything that you earn from your incentives can support your entire mission. And so I think it's important to recognize that. Okay, and then I think this is the last one before we switch over to governance. So if I were in your shoes, I'd be like, okay, this sounds cool, but like, what would this do for my health center? So like I'd mentioned, you will have access to value-based payment programs that you can't access now. Like you probably will never have heard of these. They won't bring them up to you. We actually have one that's bespoke to Kansas Care Network. So that's kind of cool and exciting. So again, new things, new opportunities. Second is a part of this process, you're going to become, I think, more aware of different ways to increase or make your workflows more efficient, have more consistency around performance. Again, it's a lot of the work that you all already are doing. It just requires a slightly different perspective. And so we want to leverage that. But we also want to, be clear that within KCN, performance is how dollars come in. And so that will be a key area that we will be working in partnership with you on, and we want you all to learn from each other as well. Next is we hope to reduce some administrative burden. So you aren't looking at 10 different agreements trying to figure out that exercise. Essentially, KCN, with support of our committees, will be laying that out. And really telling you all kind of, these are the measures, these are the targets, these are the tools that will help you achieve that. Just trying to simplify as much as possible. Next one, increasing influence. So again, this is our collective leverage together, collective power, really having a unified front with the payers as Kansas Care Network. And then last, again, I think one of the biggest struggles I had when I started a health center many years ago was a lot of this work requires you to focus on patients with insurance coverage. And I'm assuming many of you aren't working at a health center because you care about only insured patients. You care about the mission, you care about everyone. And while this work does, yes, really focus on those who have insurance, it will allow you to have access to more resources to those who don't. And these dollars are unrestricted and can be used in any way to support your mission. And so that is another area that I think for those, probably everyone in the room that is very mission aligned, that helps kind of wrap your brain around joining a network that's really focused on insured populations. Okay. Any questions before we talk about what governance looks like?
I was thinking about this project in particular. I think one of the benefits of it is, in our experience and other value, you just have to practice. It's not a skill that you're necessarily good at as an organization out of the gate. And I know when we were getting into different, I would say we struggled at the beginning when we were doing value-based contracts, and we just kind of muddled our way through, and I feel like we're pretty good at it now, and we've learned a lot. And so it's helpful for us now as we analyze other opportunities that come along, because we're used to it and we know what questions to ask, or we know what our data is or how to use it. And so it makes analyzing additional opportunities as they come along. And what's nice about this one is it's relatively low risk. And it's a great, for those who aren't doing it, it's a great entry point to get into it and to make mistakes and to work through the process a little bit and get a handle on that, so that when other contracts come along, other opportunities, when other at risk, like I think we're in a position now, we're able to look at a contract and say, we can go at risk on that because we know what we can do, and we know how we're performing, and we know what our data looks like. But I don't think we would have been able to do that without these initial steps. And so that's another, when you're even just like, what's the value of that? And I would also say, for those in the room too, the other value, the dollar amounts aren't that big, but it's another place where we can also begin practicing working with each other, and building more connections and things that, again, if it just stopped here, for me, it's not worth it. Just for what you're describing right there, but it's only worth it if that leads to the next thing. And so I think it's not getting too hyper-focused on just this. It's what does this lead to, or what does this prepare us for?
Thank you, Matthew. Any other questions or comments? I think that unpacked a lot there, and I think that was good speaking from your experience as a health center and, being involved in this kind of on your own and what you've been able to leverage. And then the opportunity that this could bring, not only, for your health center, but potentially the collective group. And that I will 100% agree with you. You have to start somewhere, and it's not easy. And you have to figure out a lot of those things. And if your health center doesn't have, a lot of experience or focus on this area, it can be overwhelming and intimidating to some degree. And so our goal is to, at least for the Medicaid portion, to help alleviate some of that, that stress or burden around that. Okay, so for the governance structure. So I don't want to get too nerdy here, but I think what's important to know that as any organization, there is a board. For Kansas Care Network, we call this the Board of Managers. And every health center who signs a participation agreement, so we have 7 health centers now, all of their CEOs or their designee is a manager. So if you sign a participation agreement, your CEO or their designee would have a role on the board. The board influences pretty much everything the network does. So the network doesn't make any decisions without them. It includes everything from extending and opening participation to other health centers to reviewing and determining whether or not to move forward with a particular value-based care agreement that has been offered by a plan. It also includes the distribution methodology. And so what that means is when incentives are earned, how do those funds flow down to the health centers? And so the board is the one that approves that methodology. And the board also looks at governance structure, committee structure, and requirements around that. So I will say, when I say this is health center led, it truly is. And our role as KCN staff is to have the information and the subject matter expertise to equip the board with making those decisions. So from just kind of a structure standpoint here, you'll see our board of managers at top. We have our 7 members. They're all managers. We have an executive committee. We have not operationalized that yet because we have a small and mighty board. And so we are just convening that group, but we do have one if we ever get to that point. And then we have 2 committees with a subcommittee. So because we are smaller currently, we've kind of combined some committee structures, quality and data, and then we also have kind of the finance and operations committee. We have, as a board, we have these committees like fully seated. Since we have not had agreements in place, we have not really effectuated the committees yet. And so that will be something that we will be working with the Board of Managers to determine how we want to start phasing those in 2026. So if your health center ends up signing a participation agreement and wanting to join, your CEO's name will be up here. And then your health center will likely have 1 or 2 staff that will be participants on here. What these committees do. So as I'd mentioned, we don't do really anything without board approval. And so for the quality and data committee, they are essentially going to be the ones looking at the quality measures and looking at the targets. They're going to be looking at previous performance, and they're going to make a recommendation to the board on where is KCN focusing, where are we selecting those 5 or 7 measures where the network needs to focus for performance purposes. They're also going to be reviewing performance and then also looking at data, so a lot of the drives, functionality, and that sort of thing. So that group will be very instrumental in helping us perform as a network. We also have the Finance and Operations Committee, so they have to do some financial regular things that are like audit committees, stuff like that. But what is unique to this committee that if you're on a finance committee anywhere else that you're probably not privy to, is that there are kind of two lenses. There's participation criteria. So at some point in time, if the board of managers says, okay, we have all health centers in Kansas, everyone is joined, but maybe what would it be like if we extended participation to a rural health clinic? What would that look like? So the finance committee would kind of look through what that opportunity would look like and either make a recommendation to the board, like let's add friends, or no, not a good idea for X, Y, and Z. But essentially, that finance and ops committee looks at kind of who can join, who can't join. It will also look at different corrective action if there ever needs to be corrective action. And then they also will be kind of the lens around contracting. So right now, this is all happening at the board level. But at some point in time, we want a contracting subcommittee where you have, someone from your health center that would join this. And then essentially we would be kind of in the nitty gritty of like what we're negotiating with the plans, how those conversations have gone, and where we want to kind of influence based off of the involvement of that committee. So that committee kind of wears a couple of different hats from a finance and operations perspective. As the network grows, these committees, if the board decides, could be broken out into more committees. So we're right-sized right now, but as the network grows, this might look different, but again, wouldn't happen without the consent of the board of managers. So if you are interested, there is a process. So you can't just kind of say, yes, we're in, even though that would be great too. So what if your health center is interested? Essentially, the legal agreement that says, yes, I'm a participant of Kansas Care Network is called a participation agreement. And this agreement essentially outlines how to participate in Kansas Care Network. And so it says you're a health center, you're a member of community care, you're an HCCN member. So there's things that like you already checked the boxes for. And then that is essentially an agreement that your team would have to review, execute. The actual board of managers would also need to take action to formally approve that particular health center joining, which we're queued up for at our next board of managers meeting. But essentially, like that's the process. I know Erin's been talking to many health centers, and so some conversations are underway. But there's opportunities to get your hands on the participation agreement, as well as talking more about like what participation would mean for your health center. So after that's signed, we will do some onboarding. So we will likely do this collectively. So after we have new entrants collectively as a network, we will do some onboarding probably in November or December in advance of the performance year starting. So that is where we will spend a bit more time together understanding what it is we're conquering in 2026 and the tools available to you to support that effort. So that's another thing to expect. The board of managers, they are the ones that determine kind of engagement requirements, if there are any. And so, again, as being a health center driven network, you all will get to determine how engaged or not you all want your health centers to be within committee structures, at meetings. And so that is a board driven decision. But right now we have our monthly value-based care learning forum opportunities. Right now they're open to every health center, but that is, again, another opportunity to learn about value-based care in Kansas and what's happening. And so that can happen whether you're in or out. And then just on the governance piece, we do want committee participation because the committees will be strong in terms of deciding measure focus, performance, and holding each other accountable. And so we want to make sure that that is well represented and has good participation. And then again, we're looking for a 2026 launch. And so as I mentioned, we're like in the heat of contract negotiations right now. And so the MCOs are like, okay, are you going to have any more? Are you going to be adding more? And so there's also a new CMS regulation that the MCOs have to execute any agreements before the end of or before the start of a performance year. No more backdating. And so they are wanting us to submit our final roster. So we're navigating that as we speak. But we will have more information, obviously, available to you all. And I know this is a group setting. If you have more questions about your health center and how this might impact you and like where you're at with your value-based care journey, because I think everyone's probably in different spots, Aaron and I are happy to talk with you about what that could mean if you haven't already touched base with him. So with that, I think that wraps up everything that we had planned, unless there are any questions from the group. Okay, so for next steps, if you're interested, just chat. If you haven't already talked to Aaron, he's your guy. I'm happy to answer questions too. But yeah, the more the merrier. We would welcome your participation.